It is time now for What's Going Around. We are tracking what's sending kids to local doctors' offices this week. Penn Medicine, Lancaster General Health Physicians, Roseville Pediatric supports a lot of RSV in all age groups. Young toddlers and infants are sometimes getting bronchiolitis from it, but not always. Older kids and adults typically have a bad cold with a pretty wet cough. RSV and other viruses have been causing a ton of secondary ear infections. They've seen a small rise in strep and COVID cases. Flu cases are still pretty low, but they did see an increase in viral stomach bugs. There's also been a flu-like illness that is negative on all viral testing but acts like the flu, with fever for 3 to 5 days, body aches, headache, and sore throat. They are also still seeing hand, foot, and mouth cases despite the season. Hand, foot, and mouth is typically seen in warmer months. The providers at UPMC Children's Community Pediatrics in York and Spring Grove are continuing to see flu, COVID, and strep throat. WellSpan pediatric medicine physicians across the Mid-State are seeing RSV, COVID, and asthma exacerbations. This week, pediatricians have seen an increase in patients with RSV as well as an increase in patients with COVID at Penn State Health. They are also seeing patients with the flu, strep throat, bronchitis, a lot of colds, and a stomach bug. And finally, the CVS Minute Clinic in York reports a slight increase in flu cases. They continue to see cases of COVID and viral upper respiratory infections. They are also seeing secondary bacterial infections such as ear and sinus infections. As always, we'd love to know what's going around your community. Log on to our Facebook page and let us know.